You are the ideal person here in Vienna to ask about optimising cancer surgery education. You've taken on that job of talking about it. What have you got to tell us about this?
Cancers affect 1.5 million European people. It's a huge population, and 80% of these patients will need surgery. Half of the patients that are cured by surgery, and surgery is definitely the most successful and most cost-effective treatment. The point is that only 20–25% patients will receive adequate surgery, up to standard surgery.
Why is that happening? Why is it not adequate at the moment?
Cultural reasons, financial issues, dissemination of up-to-date information, so that's where we want to work on.
And how have things changed? Because the art of surgery and the techniques have not necessarily had to change because the disease hasn't changed. But what has happened?
The beauty of working within the MDT and leading the multidisciplinary team is that you interact with different specialists, so this entails that surgeons come in at the right moment, providing the right treatment, achieving the best results in terms of functional outcomes, cosmetic outcomes. The cancer shrinks after neoadjuvant treatment, so we can give the better treatment at the right time.
So a coordinated treatment strategy.
Very friendly and positive multidisciplinary management.
So what is the main point that you'd like to communicate to surgeons about optimising their surgery and contributing to education in surgery?
Yeah, I think that with ESSO, European Society of Surgical Oncology, we have done really significant step forwards. We have set up a curriculum which is paving the next steps for communication, coordination. It allows fellowships, therefore young guys traveling across Europe and beyond, because we have international fellowship with North American universities.
So the message then is to get in touch with ESSO and they can help?
That would be lovely.
Yeah. Well, now, cancer in the elderly is another of your interests. What do you have in mind here as being the important areas that need to be improved?
Again, surgery very important, surgery the most important treatment. Most cancer patients are elderly, 2 out of 3. Most cancer patients, elderly cancer patients, are shown not to receive the best treatment. They show to die of cancers, and this is mainly a surgical responsibility. So there is no excuse for this failure. The way to move forward, the way to improve, is to improve the assessment of frailty. It's easy to decide to be aggressive in a very fit elderly patient, and it's easy to refrain from offering aggressive management to a very frail one. But the area in between, the grays in between, are confusing, so it's crucially important to assess for frailty.
And is it not difficult sometimes for doctors to refrain from doing things?
It is. In fact, the problem is not just the under-treatment, but is over-treatment as well, where the treatment can be more detrimental and less cost-effective than the surgical, the non-management.
So finally, how would you sum up the messages you'd like to give to doctors, surgeons and teams out there to improve surgical standards?
Surgical standards are changing all the time. It's important to keep up to date, but the best part of my job and the most enjoyable time is to communicate, to discuss, confrontation, discussion, debate, and moving things forward. We are just blessed to interact with lots of interesting colleagues. We were in Hungary last week, we will be in Poland next year, and we are in Brazil in 2 weeks from now, so this is just the right time to move things forward.
So communicating with your colleagues could help?
Absolutely.
And you can do that in some of your many meetings?
Absolutely.